Let's just frame in our minds what are the questions that you would ask your dentist. There are so many in your mind, but you hesitate asking your dentist that what is it that you're actually looking out for. Before certain surgical procedures, the dental consent is something very important. Now, there are two things that are on a regular regimen followed. Number one is your general diagnostic and written procedure of documentation of what all things are there in your mouth, what are your expectations, and what is the kind of treatment that the dentist can offer you. The second is your consent form. The consent form is very, very important because prior to commencement of any treatment, there is a legalized consent form that yes, I'm aware, I have been told about everything that the dental procedure is involving, the necessary risks, the necessary complications. Now, I'm not saying that just because we enlist a few complications or risks, you're going to have it. No, that's not that. The safety of the consent form is that you're aware, and in case there is any complication that arises, then the dentist is here to help you and take complete authority and responsibility of what the dentist is doing. That's the reason, particularly in third molar surgeries, in minor surgical procedures, the consent form is very, very important. And related to any form of non-surgical procedures, it is the consent form which is, I am aware of the treatment, I'm satisfied with the treatment rendered, and I take full responsibility of the kind of expectations that I have told the dentist. So don't fear to ask your questions to the dentist. Get them resolved before you actually decide that you want to go ahead with a treatment plan. Don't just say that I want an implant, I want this, I want tooth whitening only. Understand what are the complications involved. Understand whether it is possible for you. Make a dialogue which is a very healthy dialogue with your dentist that if I do this, what are the risks? Am I a potential candidate for a dental implant? Am I a potential candidate for teeth whitening? What are the risks that I'm going to take? And is it actually needed? Now, there's something like desire and need. It's not just the desire that needs to be met, but it's the need that has to be addressed. And that has to have a scientific basis. There's a science behind everything. So understand what your dentist is going to explain to you and allay all your fears, get rid of all your fears, sit down and talk to your dentist, and then go ahead with your treatment with a positive mind.